hello, welcome back to the Oral Health Podcast. So now a little bit of a more serious topic we're going to discuss because it is World Suicide Prevention. Mental health conditions can often show up in the mouth, and so we just want to have a little bit of a talk about signs that might be there. A short and sweet episode today, but it is a big topic and it's an important topic, so one I thought we should dedicate a little bit of time to. Karen, I hope you're all right this morning.
I am, thank you very much.
Good.
Raring to go.
Good. Can you just talk us through some of the signs that might be apparent in the mouth of things like self-harm, suicide, depression, and any mental health related signs that can show up?
Yeah, of course. And by no means am I an expert on this, but reading up on the signs, self-harming is often, but not always, a precursor to suicide and suicide attempts. So it is really important that we look out for one of the first signs, which obviously, as I've said, is self-harming. Now, self-harming can range from self-poisoning yourself, damaging yourself. So that can be by anything. I mean, I think what immediately jumps to mind is cutting, which is obviously the most common self-harm method. However, dentists really do need to be looking out for things in the mouth. Now, things in the self-harming in the mouth, unfortunately, can look like some dental disease. So, for example, receding gums, we think, oh, that's gum disease, but it may not be, because self-harming in the mouth can be where somebody is deliberately taking the gum away with their fingernail or an implement. They're sort of scratching their gum away, so the gum will shrink back. Also, there is a lot of lip biting, tongue biting, cheek biting, that kind of thing as well,
Yeah.
which may be sometimes they don't know they're doing it, really. If you're really sort of stressed, they might start doing it. And whilst cheek biting is really, really common, we're talking more to a degree of causing ulceration in the mouth. So when you go to the dentist, they might see that you've got an ulcer or something like that, and may not necessarily put it down to that. And I think we have to look at maybe scarring that has occurred, but it can be really difficult to approach that subject because we all get ulcers from time to time, and I think we have to look at where the ulcers are and the frequency of them as well. But it's a difficult subject. You
Yeah,
could
it
say to
is.
somebody, how are you getting these ulcers? Well, how often do you get them? And it could be entirely due to hormonal changes, due to a lowered immune system. There's lots of things that can cause it, which is why it kind of slips through the net a little bit. But if somebody, like I say, has been sort of picking at their gums in one position, and you've got recession around one tooth, that would ring alarm bells, really, because gum disease does tend to affect more parts of the mouth. Not always, but some. So I think it's something we have to be aware of,
Yeah.
and that's why it's difficult to pick up, because it mirrors so many other oral diseases. And I think if you actually treat what you think is the oral disease and it doesn't get better, then you might want to be having other conversations, you know perhaps giving them a telephone number. I mean, I think, by saying to somebody you need to go and see your GP, it might be a bit too much for them. They may not be ready to take that step. But there's lots of groups that can help them. I'm sure you'll be able to put some helpline numbers with this podcast, so that
Yeah,
anybody
absolutely.
who does want to investigate getting some help. When people have eating disorders as well, and I know that's not sort of looking to not necessarily being suicide, although unfortunately some people do die of eating disorders. That will show in the mouth as well, because although the excuse me, the self-harm is a result of what they're doing with their eating disorder, that still is a problem. Many people eat things that are um, not for
Edible.
human
Yeah.
consumption. I mean, I've known people eat rubble and, plaster from the walls. I mean, all of that will cause wear on the teeth. So it's a case of just your dental team. You may feel more comfortable talking to your dental team because they're not coming from the sort of mental health kind of angle. And you may be worried about the damage that you're doing to your soft tissue in your mouth, your gums, your lips, your tongue, your cheeks. Um, just flag it up to them, and they will be able to help you. I mean, it's not that they don't know what to do, because they will know what to do. And in a lot of cases, the issue is resolvable because you can just heal. I mean, the mouth has a good capacity for healing. So
Yeah, it
it's
does.
just a case of doing something else and stopping doing it, because it becomes a habit, doesn't it? It's like a release. And most self-harming is about getting that relief from, your thoughts and everything that's sort of going on in your life. So it's it's important to get help, and I know it's not easy, but it might be the first step if you talk to your dental team. It doesn't have to be the dentist. Speak to the nurse. The nurse
Hmm.
will equally be able to help.
Yeah. And by no means, if you are a dental person, dental professional, by no means are we trying to say it's your responsibility to pick up on these things
No.
and that it's the first thing you should think, because it's often not, you know.
Mm.
It's just, it should be a part of the puzzle, even if it's not the main thing you're concerned about. Always have it in the back of your mind. But
Yeah.
obviously,
Well, I
it's
think
so nuanced.
when you go to your dentist and and you have a checkup, they will almost have a sort of a mental checklist in their head about what's causing any problem that's in the mouth. So what they would do is start eliminating what the problem could be, and you can kind of get down that, and you can get to the bottom of it. If it is a dental problem, then it will be cleared up by the treatment. If it's not, then that might be a reason then to have a deeper conversation with your patient.
Yeah.
I mean, cheek biting is incredibly common because that piece of your cheek kind of just sits where your teeth meet together, and it's very tempting just to go. You see people all the time kind of cheek biting, and then when they open their mouth, they've got a lovely like callus, like a white line callus inside their cheek. I suppose you could say that is a very, very mild form of self-harm because you are damaging the structure of your cheek, but it's not problematic. It's not going to
Yeah.
cause you any lasting damage. So don't worry too much about that. It's when the areas are getting ulcerated, they're getting sore. I even read one case where unfortunately a young person had taken a hammer to their front teeth because psychologically they didn't like the look of their front teeth. I mean, I know that's sort of slightly different to self-harming, although it is self-harming. It's not something that obviously he did regularly. He did
Hmm.
it the once. Um, but it can go to that extreme. If nobody's listening to you, um, then you take things to extreme, don't they? If you yeah, if you've got no one that's you feel that's going to help you, but there is help, definitely. Just talk to
Yeah.
somebody.
Yeah,
Doesn't have to be
definitely.
anybody or you've got lots of different places that you can go to anonymously and just have a chat about it. I mean, obviously, if you're young, you can go to Childline and just talk about what's going on. If you've got a good teacher in your school, I mean, they're very, very good. Some schools have great pastoral care that will be obviously trained, that we're not trained, or you are to a better degree than me, Sophie. So
Yeah.
I mean, your experience is obviously much greater than mine.
And there is a term in counselling and mental health care. I can't remember the name of it off the top of my head, but basically someone will make a big disclosure as they're about to leave, and it's like people do it so that they can say they've done it, but they don't actually have to deal with it. I can imagine that kind of thing is more common than a sit-down disclosure. But maybe if you just get on really well with someone, it might be like, oh, well, teeth aren't looking that great today, probably because I've spent the last months doing whatever, and like they drop it kind of nonchalantly. But it should be something in the back of the mind to think up. And obviously when you get younger, you think about safeguarding and raising all the flags you need to in terms of that. But it's such a nuanced topic, and that's why I said we're not going to dwell too much on it. But because it can be picked up, it's something to at least draw attention to.
Certainly, you might have dental professionals out there that have seen this patient and they think, I have no idea why this is happening to this patient, why they keep presenting with the same problem, and I can't find a dental reason for it. It's a possibility. It's worth saying, is everything okay? Do you want to talk about it? If they don't want to talk, fair enough. We're not there we're not trained for this. We're dentally trained, but it may be that it's sort of such an anonymous environment, because you're not going to be talking about mental health, talking about your teeth. It might be somebody opens up. You never know. It's stranger things have happened, and we're always there to help, and we're always there to listen to people. But as I say, it's better to speak to somebody who is trained in the subject that we're not.
And we can also talk about things like there is statistics out there that dental professionals are among the highest amount of medical professionals to take their own lives or have suicidal thoughts or actions, and that is a topic that is so sticky that I don't know if I necessarily feel comfortable discussing, because it is so, there could be a million and one reasons for that, and it's
absolutely and as a profession, it is a very stressful profession, and over the years it's got harder and harder to deal with that. There's so many pressures from so many angles, and unfortunately it has this knock-on effect, and like you say, it's among the highest profession of suicides, which all I'd say is, if you're feeling like that, please talk to somebody.
Absolutely, that's essentially what it comes down to. And we'll be back next time discussing something a lot lighter. We want to draw attention to dental tourism, turkey teeth, and the things that can come from that. We've got some fun stories, but we will leave you be for now and come back next week if you want to learn a little bit more about that.